Hello everyone, this is Owen Rumlard, and today you're here to learn about heart arrhythmias. Heart arrhythmias, also known as heart murmurs, they occur when the electrical impulses that coordinate your heartbeats don't work properly, causing your heart to beat too fast, too slow, or irregularly. So there are two main types of arrhythmias. Tachycardia is when there's a fast heartbeat, a heartbeat that is greater than 100 beats per minute. Bradycardia is a slow heartbeat, which is a heartbeat that is under 60 beats per minute. There are several other more specific types of heart arrhythmia that I'm going to briefly list now. Now, I'm going to list types of tachycardias in the atria. Atrial fibrillation, atrial flutter, supraventricular tachycardia, Wolff-Parkinson-White syndrome. Now I'm going to list tachycardias in the ventricle. Ventricular tachycardia, ventricular fibrillation, long QT syndrome. Now I'm going to tell you some of the main causes of heart arrhythmia. Coronary artery disease, electrolyte imbalances in your blood, changes in your heart muscle, injury from a heart attack, the healing process after heart surgery. Here are some additional risk factors that increase your risk of developing arrhythmia. High blood pressure, congenital heart disease, thyroid problems, drugs and supplements, diabetes, obstructive sleep apnea, drinking too much alcohol, excessive amounts of caffeine or nicotine use. The tissues directly affected by arrhythmia are the cardiac tissue as well as nervous tissues found in the heart. Since arrhythmia is caused when electrical signals are not properly sent throughout the heart, it either causes the heart to beat faster or slower, so the nervous tissue is not properly controlling it, resulting in the cardiac tissue not being able to properly pump the blood around the heart, which then gives you arrhythmia. Since there are so many different types of arrhythmias, I could not find specific numbers on how many Canadians are affected by all of them, but I did find a specific number related to atrial fibrillation, which is the most common type of arrhythmia, also known as AFib. Approximately 350,000 Canadians are affected by AFib. Medical technology that is used to diagnose arrhythmia. The most common medical technology used to diagnose arrhythmia is an EKG. This simply detects the electrical activity of your heart, so then it can see how fast or how slow it's beating. It can show if a heart is beating too quickly or too slowly, which can then lead to a diagnosis of arrhythmia.
You're about to send a series of electric currents through your body. Hopefully the shocks will be enough to slow your heart rate back to normal. Clear! Denny, you are a lucky man.
With certain types of arrhythmia, such as AFib or VFib, your doctor could use cardioversion, which is a procedure conducted by delivering a shock to your heart through paddles or patches on your chest. This will shock your heart back into normal sinus rhythm, which then corrects the arrhythmia for specific types. Some lifestyle choices that can be made to help prevent arrhythmia are: eat healthy foods such as lots of fruits and vegetables and limit the amount of salt you get. Try to keep yourself at a healthy weight. Limit or avoid drinking excessive amounts of caffeine and alcohol. Do more physical activity. It helps keep your heart more healthy. Reduce the amount of stress you have in your life, as it can lead to heart rhythm problems. Avoid using over-the-top cough and cold medicine, as some of them contain stimulants that can rapidly increase your heart rate.